I've got a dirty word for you. Cancer. None of us like to think about cancer, but about 40% of Americans will eventually develop one form of cancer or another in their lifetime. Recently, there was some good news. Guardian Health came out with a Shield blood test for colon cancer. They're requesting FDA approval. It picked up 83% of colon cancer. A simple blood test. Sounds like great news. But I've got a question for you. Would you rather detect your colon cancer after you develop colon cancer, or would you rather just prevent it in the first place? Most cancers, you go with no choice. There's no prevention. There's detection. I'm approaching my 77th birthday. I've had many prostate checks. I go in and see my doctor. He does a physical exam, a prostate exam, a PSA blood test, often a biopsy. I've had several of those. And you wait for the results. And the question is, do I have prostate cancer yet? I want to go to my doctor and say, how do I prevent prostate cancer? There's no answer. We're trying to catch it when I eventually get it. It's a terrible situation. Most cancers are like that. Pancreas cancer, lung cancer, kidney cancer. One is different. Colon cancer is different because colon cancer has a means of prevention. Colon cancer starts as a non-cancerous polyp on the inner wall of the colon. The colon is hollow. There's an opening at the end. We can actually go into the colon with our colonoscope and find these polyps and remove them. A polyp removed is a cancer prevented. You can do a test like Cologuard, which is a stool test, or now this new blood test. But they find your colon cancer after you have colon cancer. The new Guardian Shield blood test finds 83% of colon cancer. That sounds great. It finds precancerous polyps only 12% of the time. So if you have a normal test, there's a 90% chance you still could have a polyp headed for cancer within your colon. The Cologuard test is similar. It's extremely accurate at finding colon cancer after you have colon cancer. It doesn't prevent it. Only colonoscopy is a colon cancer prevention test. They really shouldn't call it colon cancer screening. You should call it colon polyp screening to prevent your colon cancer. That's really a more accurate way to describe it. I've done 68,000 colonoscopies in the past 47 years, and it's gotten better. The equipment is better, the anesthesia is better, even the preps are better. The test is more accurate. It's a safe and painless examination. I've had 7 of them. I've had multiple precancerous polyps removed from my colon. So if you're interested in a blood test, you have to realize it's not a test to prevent your colon cancer. It's a test to find your colon cancer after you have it. Same thing with a Cologuard test. Personally, I vote for colonoscopy because I want to prevent my colon cancer. I don't want to detect it after I have it. I think it's a great misconception that the Cologuard test and the stool test and this new blood test are screening tests to prevent colon cancer. They do not prevent colon cancer. They detect it after you develop it. If you want to prevent your colon cancer and you're over 45, talk to your doctor about screening colonoscopy. Dr. Robert Fusco, 47 years of experience as a clinical gastroenterologist, 7 times patient for colonoscopy. I vote for colonoscopy. I vote for prevention over early detection.